A 55-year-old man has a long history of the achalasia. He is successfully treated by the Heller's cardiomyotomy. Several years later, he developed esophageal malignancy. Which of the following lesion is most likely to be present? That means a patient suffering from the achalasia and the Heller's cardiomyotomy operation done, but again the rest of the esophagus, from the rest of the esophagus, the malignancy developed. So which type of malignancy is this? Here the options are adenocarcinoma, gastrointestinal stromal tumor, which is the cyst, leiomyosarcoma, rhabdomyosarcoma, and squamous cell carcinoma. So which type of cancer may develop? Here we can see the achalasia. Achalasia, actually it is the motility disorder. That means, imagine this is stomach and this is esophagus. So what occurs in the achalasia cardia? There is the loss of the ganglionic cell in the esophagus. For this condition, this portion of the esophagus is constricted. This portion of the esophagus is dilated. In case of esophagus, it is the dilated. So the abdominal part is dilated, and there is a collection of the food, collection of the mucus secretion, and all the things they are collected in this area. So what occurs? There occurs a chronic infection and chronic inflammation. So when there is a chronic inflammation, that means inflammatory process going in the longer period of the time, or when there is more friction, in this case squamous cell carcinoma develop. So what happened in case of the achalasia cardia? In case of the achalasia cardia, it is the rare condition, but it increased chance of malignancy even after operation. And what is the type? It is the squamous cell type. Why squamous cell type? Because here chronic friction, chronic inflammation. So when there is chronic friction, chronic inflammation by the foreign body or other things, in this condition there is development of the squamous cell cancer. And in case of the gastroesophageal reflux disease, which is the GERD, that means the bile reflux. Imagine this is the stomach. So bile reflux, in case of the bile reflux, that acid reflux or acidic bile reflux, it occurs, the stomach content goes to the esophagus, and in this condition adenocarcinoma develop. So here, in what carcinoma develop in case of the achalasia? It is the squamous cell carcinoma. And what type of carcinoma develop in case of the adenocarcinoma? It is occurs in case of the gastroesophageal reflux disease.